Accountable Care Organization is an organization that is focusing on making sure that we can deliver the appropriate clinical outcomes, drive for the overall health improvement of that population, and making sure that it's done in an affordable way.
The point of an ACO is to bring these doctors, hospitals, pharmacists together in a care system so everybody has a common understanding of your needs and everybody is working together.
If the healthcare providers and the patients and the employers all working toward the same goal, we have a better chance of achieving that goal. So it's about how do we actually make healthcare better.
Aurora has a long history of care management. They've been doing this for over 10 years.
Our healthcare cost increases have been at single digits where the market's been in double digits.
We think of being partners with patients. The patients do have responsibility for their own healthcare.
If we don't empower the patients to be able to do a better job of managing their disease, we will be limited in our ability to improve quality and reduce costs.
There's going to be a lot more connections and a lot more conversations about staying healthy and well versus waiting for them to come in and be sick or ill and then treating them. Patient satisfaction also increases because it's more immediate access. They're getting more information about their care.
That's what we want. We want to exceed that patient's expectations. We know that when you invest in your employees, that you will get not only cost savings, but you're going to have a happier employer. You're going to have an employee that is engaged, an employee that is glad to come to work.
If we can be more efficient in delivering healthcare, so we can keep people healthier, the cost of healthcare, typically borne by the employer, will go down. And we believe that doing it with an eye on wellness and preventive care in a coordinated, integrated way makes a lot of sense to help lower that cost.
They get a healthier workforce and they get a more predictable healthcare spend.
It's a recruitment and a retention piece. Wouldn't you like to work for someplace that cares about you? Wouldn't you like to work for someplace that makes you a healthier person and is concerned about your family's health? A big piece about doing coordinated care is having the right information at the right place.
We have one medical record, which is electronic, and we can access anybody's record that's under the plan.
Having that information correct in the electronic health record really adds multiple levels of safety for patients that is really a benefit to them as we go forward.
When the next physician or the next provider is picking that patient up, they understand exactly what their colleague did, what their colleague's expectations were, and they can help make those connections and help coordinate that care.
It's a much more efficient and effective way to care for folks because all the information is available at the time we need it.
A nurse navigator is a telephonic resource that we have here at Aurora that members can access. We connect them to the correct resources, whether it be their personal care physician, whether it be their pharmacy, whether it be outside resources as community resources.
We connect with them to make sure that they understand their diseases, their issues, and understand how to navigate the system as well.
An on-site nurse is employer-based, on-site at the employer site, with face-to-face interactions. We engage people once we're on site to, for example, get regular screenings, get regular office visits.
The things we like about Aetna is that they share a vision that we share, that it's really important to keep people well.
Aetna stood out in a lot of categories. One that was an organization that was willing to understand the trust and the accountability that goes into a relationship.
This is really a better way to do it. This makes sense. This lines up the incentives from an economic standpoint. It lines up participation of the patients so they get to pick and choose and be engaged in it. The providers like it, and they're using their best resources to make sure it's gone well, and we're getting better outcomes. So it's a win-win-win-win-win.